Welcome to Taboo to Truth podcast. This is Allea Francis, my wonderful pelvic floor physical therapist.
So happy to be here.
Let's start out by just giving me a little bit of background. I know you go by Dr. Allea, so just quick synopsis of your credentials.
You got it. I am a doctor of pelvic floor physical therapy. I got my PT degree at the University of Missouri. I then pursued a specialist in pelvic floor physical therapy after PT school. Then I did a fellowship/mentorship training in Tustin, California, where my foundation really is in chronic pelvic pain and more high complex pelvic floor dysfunction. I really dove deep into that realm for 5 years, and then I decided to start my own practice, and I really just started to dip into multiple specialties. I love pregnancy and postpartum. I love menopause, hormonal health, and I also love biohacking to it, which is starting to change lifestyle habits that interface with our hormones and our systems to impact our health overall and how that influences our pelvic health.
Wow. That's a great balance of everything related holistically to the body. And do you work with all genders?
Yep. So I say anyone with a pelvic floor, with a pelvis, would benefit from pelvic floor physical therapy. The muscles have such a unique function. So they have a bowel, a bladder, sexual reproductive support stability functions. These tiny little muscles are doing so much. And so if one thing is off, then the whole system can go awry and start to compensate. Whether people have pelvic floor dysfunction or not, I think it's beneficial for everyone just to be assessed and see where they're at in their health.
So let's back up a little bit and explain to the audience what the difference is between a pelvic floor physical therapist and a regular physical therapist, and then maybe a little bit more about what the pelvic floor is. It's kind of intuitive for most of us, but for people who may not know exactly where one comes in and the other goes out.
That's such a great question because I get this a lot. So when I talk to people, I am a physical therapist. My background is in orthopedics. That is my training. However, I do specialize with the pelvic floor. Here is the pelvis. All of the red are the pelvic floor muscles. This is my specialty. I really say I specialize from the diaphragm down to the hip. This is part of the core systems.
What is the difference between a regular physical therapist and a pelvic floor, and then physical therapist, and then what is the pelvic floor more?
Okay, so all the red are the pelvic floor muscles. They have a bowel, bladder, sexual reproductive support and stability function. What differentiates me from a regular general physical therapist is that our background is in orthopedics. That is what we are all trained in to do. And so I can treat necks, shoulders, hips, down to the feet. But then I have specialized training in the pelvic floor. And so what's unique about my job is that I can treat these muscles internally. That means I use my digits and I can map out these muscles because these muscles are only found to be internal. I think about these muscles like your jaw muscles. Some of the best way to access your jaw muscles are to go intraorally to palpate them. I have that specialized training, and it's not just how to map out these muscles that are in a cave, but how to ask for consent, how to move through situations that may be really uncomfortable for people or people who have potentially had trauma to this area.
The pelvic floor is basically anything like from here to here. Or you treat from here to here, but the pelvic floor is what holds up.
You got it.
Okay.
So this is the pelvic floor specifically. It is the group of muscles. I treat from here to here because of the impacts that the muscles in your diaphragm down to the hip. Like these muscles right here are hip rotators.
Okay.
So I have to treat this joint And in order to treat this part of the pelvis, I have to treat the abdominals.
Okay, got it. All right. For our viewers, since this model is a little far, that's the vagina. No, the vulva.
Yep.
Or both.
So, yep. Yeah. No, that's a great clarification. Vulva is the external tissue, and the vagina is the tube. This specifically is the vestibule, the opening of the vagina. And then, so if I were to be internal, this is the vagina, and every tissue external is the vulva.
Okay, perfect. I totally get why you would work with women who are having issues in prenatal and postpartum. Why would a woman who is in midlife or in menopause or premenopausal come to see you?
I get this question a lot because people understand the importance of pelvic health when it comes to childbearing. Like, a lot is changing in this area, but things often change as our hormones are changing in age. So our hormones, as our estrogen, our progesterone, our testosterone are declining. Our bone health is also declining, unfortunately. Our cardiovascular system is also changing, which can affect how our muscles move, how they glide and slide with our nerves and our blood flow. People who are going through menopause, perimenopausal, there can be tissue changes. The tissue can be dry and cracked, and the tissue specifically is in the vulva or the vestibule or in the vagina as well. And when that tissue is dry, then the nerves cannot glide and slide as easily, making painful intercourse or painful penetration. It can also cause irritation to ligaments and tendons in that area and to the SI joint or tailbone, but it can also cause ligamentous laxity of the uterus, of the bladder. We may see more descend into the pelvis, but this also plays a role into like diet and nutrition, because things start to change. What we used to eat before does not necessarily work now, and a lot of women start to add in weight into this midsection, which will put pressure on the pelvic organs, which can contribute to prolapse, which is a feeling of heaviness or pressure in the vaginal rectal region.
As we become perimenopausal, all the lovely things about menopause, lots of things happen, as I'm understanding it. Things start to get looser, and as someone who has suffered from all sorts of aches and pains through my life, when your ligaments get looser, your muscles tighten up and tend to overcompensate. We've got just general laxity of the ligaments, tightening of the muscles. We've got digestive issues as well that can be treated. Constipation, which is another lovely little symptom of menopause. And then just the loosening causing the bladder, the uterus, rectum, all our parts to
descend, pelvic pain, urinary retention. A lot of things can start to shift and switch when our hormones are shifting and switching.
And I'm just going to add the one more piece, which is also, and in fact, full disclosure, this is how I came to Allea, is that I have chronic hip and lower back pain. And so she is also treating me for those things. It's not only what's going on internally in terms of your reproductive organs and your GI, but also as it relates to overuse of your muscles, your pelvic muscles.
Right. So that is like the beautiful bridge between like orthopedic physical therapy and pelvic floor, is because we have this background and knowledge of how your core muscles and your hip are all playing a role. And then the pelvic health perspective is now we can treat the other group of muscles that may be playing a role. We really get this holistic approach, whereas some people don't get that training.
And you don't want the physical therapist who specializes in knees and elbows treating your pelvis. No. Well, you might, but they may not be as good.
And they probably don't want to do it either.
Let's shift the conversation to the Taboo to Truth main event, which is let's talk about sex.
Yes.
How can a pelvic floor physical therapist help my sex life?
I love this question. Your sex life is such a complicated system, honestly.
Really?
There is a mental component. There is, especially with women, right? There's a cognitive, there's emotion, there's a physical component as well. I like to address all of those things, but really I hone in on the biomechanics and the muscles. For example, if our muscles are innervated by nerves, and our nerves need blood flow, and our tissue needs blood flow. They're all playing together in this circle, in this loop. If one is not functioning, then they all start to become dysfunctional. As we age, or we're going through menopause, our blood flow limits, which makes the nerves feel irritated, which irritates the tissue on top of the muscles. Muscles don't like it. They guard, they become tense. Where I step in is from the muscular and tissue level, where I'm starting to create blood flow with my pressure, with my manual therapy techniques. And then that can help lubricate the nerves so they can slide and glide a bit easier, making it more pleasurable. It will also increase lubrication to that area. It's a win-win.
What about orgasms?
Yeah, definitely.
We want good orgasms.
We want good orgasms. We want a strong pelvic floor for good orgasms. So these muscles right here, the more superficial muscles, they hug around the clitoris. These muscles also share connections with the inner thighs, the adductors, and the abdominal muscles.
The squeezy ones, ladies.
Yes.
We want to be able to squeeze.
Exactly. This is where like inner thigh work is such a powerful exercise. I think a lot of people are like, be careful with inner thighs. You don't want to over tighten them. We want every single muscle to be able to move through a full range of motion. Your inner thighs need to be able to be strong. This muscle, ischiocavernosus, can be strong to elicit an orgasm. And again, we need blood flow to the clitoris. We want the clitoral hood to be able to move and slide and glide. You can do a topical estrogen to the clitoris, and it'll help plump up the clitoris for blood flow to also help with orgasms. Most women have clitoral orgasms. I think it's like 80 or 90%.
Remember what I told you about the glorious clitoris, right? The glorious clitoris is the only organ in the human body, men don't have one, that is strictly for pleasure. So we want to make sure that that's working. Everything that contributes to that is working properly. And yes, it's apparently the latest research is somewhere over 10,000 nerve endings in our clitoris.
It can be very sensitive.
Lucky us. We want to keep that working. Now, why can't I just do a bunch of Kegels? And that's the one that they taught us when we were teenagers.
Yeah. I always say your pelvic floor deserves more than Kegels, because to isolate a Kegel, the Kegel is this muscle inside, and it's pretty far away from the clitoris. A completely different muscle. Kegels will help squeeze, but a lot of the time people don't completely relax. A Kegel can become dysfunctional very quickly because you need to be able to, again, move through a full range of motion and not just tighten and tighten and tighten until you're cutting off nerve and blood supply, which is what happens. And then this is where leakage comes in, because your nerve that's coming through innervates the bladder. It's not getting that neural input that it needs.
Too many Kegels can actually be counterproductive.
100%. A lot of the time it's counterproductive. And so if you want better orgasms, functional training like adductor side planks with an adductor squeeze, bridges with an adductor squeeze are great exercises to create a strong pelvic floor, because then you can still move through a full range of motion, and then following it up with stretches as well.
All right, I'm going to put a list of Allea recommended exercises in the show notes so we all have very strong pelvic floors and loose enough, yet strong enough. Mm-hmm. Loose enough to be relaxed and not cause leakage, but strong enough to enjoy sex.
Exactly. Balance.
Right. Balance. Exactly. All right, so now I've got some issue, whether it's painful sex or constipation or just tight hips. I come to your office. What do you do?
I will walk you through what I do with patients on the first visit. I try to make people feel as comfortable and safe as possible because I know it can be a little scary and intimidating. I have their intake form, so I've asked already beforehand, bowel, bladder, reproductive sexual function, all of the things. I take them through a pelvic floor 101. So I tell them exactly what my job is, what each muscle's main function is, and what I think is going on with their pelvis.
And now what if I'm too embarrassed to tell you that, like, it's only when his penis is inside of me, or it's only when I use a vibrator, or what if I'm embarrassed to tell you some of these things?
I always say too, I am so open with communication. I'm so transparent. There's not enough, there's no such thing as too much information. I need it all. There's no judgment. I love and support whatever you do inside the bedroom, and I will do whatever we can do to make it work and it to be pleasurable. If you feel too embarrassed, don't be.
I'm sure you've heard it all.
I've heard it all. People talk about squirting, and I'm like, all right, let's pick that one apart. Let's dive deeper into that.
I know squirting's got this, squirting and anal sex are having their day, and everybody's talking about it now. Fisting, all right. See, whatever floats your boat.
That's why I'm just like, I need to be able to lengthen my pelvic floor for fisting. And I'm like, I've got you. We're going to do this. It's a dilator program. So it's just, if you're up front, I don't carry any judgment in this space. I'm here for the kinks. I'm here for just the vanilla sex too.
Now I've told you all my problems, or I haven't told you, but you know that there's obviously some issue that brought me in. I got my pants off. I'm lying on the table. Bring it on, Allie. Okay. What happens now?
Yes. Okay, so I've gone through a pelvic floor 101. You know what my job is. We've done a biomechanical range of motion strength assessment, the very general orthopedic part. That kind of like, now we're a little bit more comfortable. My hands have been on you. Your clothes are on, and now it's time. You're draped. You have a towel over you, the gown, so you feel very appropriate. And it's not like a gynecologist where you're at the edge and your butt's hanging off. It's not like that. It's like a massage table. It feels nice. It's comfortable. I come in and I always start with the abdomen. I assess how people are breathing. I do a little tummy massage. It's definitely way more than that. It can be very medical, but I am just assessing their bladder, their reproductive organs. I'm looking at how they're holding tension, because your core tells me so much about your pelvic floor. If your core is tight, your pelvic floor is tight.
Interesting.
They're co-contractors. Like if you pull your stomach in now, you can feel your vagina lift up, right? I'm looking at those things. And then we get into the internal exams. This part, if you've ever had pelvic floor PT, this is where people should ask for consent like 100 times. All right, this is what we will be doing next. Are you okay with that? Okay, I'm moving here. Are you okay with that? And so I think that's really important to know.
It reminds me of the Seinfeld episode when George has a massage from a male masseuse and says it moved. What happens? Like, do people ever get aroused? Like, someone's sticking their fingers in you. Sometimes that can be.
I mean, the goal is to get blood flow. Blood flow equals arousal. Yes, it does happen. I think people don't admit it. I think they're trying to keep it cool, which I appreciate too, because I try to be as medical as possible and keep like very firm boundaries. And I'm like, if you're feeling aroused, we love that. Go home and try it out. Like, let's see if it works. That's a lot of my homework. I'm like, now go home and have sex, or go home and masturbate. That's kind of like the fun part of my job too. Like, my homework is to prescribe sex.
We love that.
Yeah, it's like, okay, go home and try doggy style now. We're going to see if what we did had any change. And a lot of the time it does. Yeah, it can happen. And that's the goal. And I think as long as everyone is appropriate about it, and I always state those boundaries in the beginning too, and I think I'm pretty easy to get along with. You should feel open. If you're feeling aroused, tell me, and then I can like back off a little bit. So yeah, I'm like, that's great. I'm just going to go drink some water. You collect yourself and I'll be right back in.
And I mean, you all know that I am very relaxed in a lot of atmospheres. And so I can discuss the weather with Allie while she's doing her thing. But for many people, they're not as relaxed as me. And so she really does. And I think any well-trained physical therapist, pelvic floor physical therapist, is going to be very good at keeping a boundary between that. And really, they're really helpful. And I'm sure you've seen clients where their marriages were almost, or their relationships rather, would have been falling apart for not, if not having some way to fix their sex life.
100%.
Women who are on the other side of the fertility stage, but really want to have sex and sort of give up because of dryness or pain, whatever it is, this is really a wonderful, wonderful treatment.
Do not give up. Do not give up on it. And if you just haven't found the right people yet, is what I say. You haven't found the right things yet. There are things that we can do. It may take a bit, but there are things that we can do. And a lot of it is this brain to body connection. So we have to just connect the two.
What are some of the there's some prescriptive tools. You were mentioning vaginal estrogen, things that lubricate the vagina, but what are some other things that we can do to bring the pleasure back into sex after having experienced
lubrication?
There is nothing wrong with bringing lube.
Get lubricant. It's a game changer. Vibratory tools, they can create pleasure, but they are doing such good work. I have people even who have pelvic pain start on a vibration because it can down-regulate the nervous system, or it can up-regulate the nervous system depending on the vibration level. So if it's a slow, warm vibration, that can relax and calm your system. It brings in blood flow, so that's healing to our tissue and helps relax our muscles, like a Theragun, right? On your leg, it relaxes, or it can excite certain organs in certain areas. Vibration is not just for fun, it's a very healthy thing that everyone should be having in that area.
Even when there's pain?
You can. It's just at a low vibrational setting. It's not something I'm like, hey, go grab a vibrator out of a shop and just use it on that area. It needs to be a medical vibrator where it's a slow, certain threshold. And if you can put it external, on your abdomen, anywhere on the external anal sphincter as well. And that it helps create blood flow to that area, which your nerves need.
And blood flow to the area in general as we age is super, super important. That's why having sex, I'm all about making sure we have sex until we die, because it really does help the blood flow. It helps the muscles stay stronger. It helps everything feel better.
Blood flow is everything. Blood flow is absolutely everything.
Yes. Everywhere.
Mm-hmm.
You mentioned earlier a pleasure map. What's that?
Yeah, a pleasure map is so cool because I like to integrate it into people who are having pain with penetration. And so a lot of the time there's this stigma that sex is penis and vagina, and that doesn't have to be that way. Your ears can be stimulatory, your nipples can be stimulatory, your butt can be stimulatory, your feet, there's so many areas. And so what a pleasure map does is you can work with your partner in so many ways, or with yourself, of where your erogenous zones are and where your least erogenous zones are. And you start with your least and you work into your most. It's this climax buildup throughout the weeks of stimulating the top of your head, something that's not erogenous. And then, week 3, week 4, you're in nipple play, right? So it's helping your partner figure out where those zones are without going to the vulva or vagina.
And that's an excellent, excellent tool, especially if you've been afraid to have sex because of pain or sexual trauma. Mm-hmm. I think that's a wonderful, wonderful tool. I'd never really heard of it before.
Yeah, there's another term, which is sensate focus. It's a regimen that I think you could probably look up online, but pelvic floor physical therapists should know about it. But essentially, it's a process where you're working with your partner on exactly what I just described and inching towards your goal, whether that's penetrative sex or if it's orgasm or if it's pain-free intercourse. So,
wow, excellent information. Anything else that you would like to add regarding the pelvic floor therapy, why we need it, what we should be wary of perhaps, and finding what if we can't find a pelvic floor physical therapist because we live somewhere that they don't have any.
It's never too late to get a pelvic floor physical therapist, or at least call someone. A lot of pelvic floor PTs are such helpful, generous, giving people, but a lot of us have walked this path where we've been like, WTF is going on, and we've had to become our own practitioner. It's never too late. There is help. Find someone that is a good fit where you feel comfortable to heal.
And where can people find you?
I'm in San Juan Capistrano and in Irvine.
These are in California.
And I also do pelvic health coaching too. I can go outside state borders.
Is there a website that's the same sort for pelvic floor physical therapists?
pelvichealthrehabilitation.com, pelvicguru.com would probably be the two big ones that a lot of people put their names through.
And what are the credentials that you're looking for in a pelvic floor physical therapist?
Oh, that's a good question.
Just general, like higher level.
PT, DPT. That's all I don't have any special certifications, but some people have WCS, Women's Certified Specialist Training. PRPC are credentials that you would also want to look for.
But you definitely want to have the PT and DPT after your name. All right. This was really, really informative.
Thank you so much for having me. I love this podcast so much. Aww. It's so informative. I love it. I love that you are destigmatizing sex in general with women who think their sex lives are over, and it's not.
Thank you.
I agree with you.
Thank you.
Have sex until you're broken.
There you go. Yay. Thank you.
You're welcome.